Hello and welcome to ParentUno. Finding out you're pregnant can feel magical, emotional, exciting, and honestly a little overwhelming too. Whether you saw those two pink lines at home or heard the confirmation from your doctor, one thing becomes real very quickly. Your body is now supporting a growing baby, and naturally you start wondering, what should I avoid? What foods are safe? Can I exercise? Is everything normal? So in today's video, we're going to walk through everything you need to know about the first trimester of pregnancy, including symptoms, precautions, diet, lifestyle habits, safety tips, and common mistakes to avoid. Let's begin. Pregnancy is divided into 3 stages called trimesters. The first trimester includes the first 13 weeks of pregnancy, roughly the first 3 months. And remember, pregnancy weeks are counted from the first day of your last menstrual period, not from the day conception happened. Now, many people say the first trimester is the most risky part of pregnancy. That statement is partly true, but also misunderstood. Here's why. During these early weeks, your baby's major organs and body systems begin forming. Because of that, things like uncontrolled diabetes, smoking, alcohol, unsafe medications, infections, or poor nutrition can potentially affect the baby's development. But at the same time, a healthy pregnancy is naturally designed to be strong and resilient. Normal walking, daily movement, gentle exercise, working, traveling carefully, or even intimacy usually do not harm a healthy pregnancy. So instead of panic and fear, the goal is awareness and proper care. The very first thing you should do after confirming pregnancy is schedule a doctor's appointment. Your healthcare provider may confirm the pregnancy, calculate your due date, order blood tests, check your medical history, and possibly recommend an early ultrasound scan. One of the most important supplements in early pregnancy is folic acid. Folic acid helps reduce the risk of neural tube defects involving the baby's brain and spine. Most doctors recommend starting it as early as possible, ideally even before pregnancy if you're trying to conceive. If you already have medical conditions like thyroid problems, high blood pressure, diabetes, or epilepsy, it's extremely important to keep them properly controlled during pregnancy under medical supervision. Now let's talk about some major lifestyle precautions. If you smoke, stop immediately. Avoid alcohol completely during pregnancy. There is no proven safe amount of alcohol during pregnancy. Alcohol exposure can affect a baby's physical growth, brain development, and long-term behavior. Recreational drugs should also be strictly avoided. Now, many women ask about coffee. The good news is, moderate caffeine is generally considered safe. Most medical guidelines suggest staying below 200 milligrams of caffeine per day, which is usually around 1 to 2 small cups of coffee. But remember, caffeine is also found in tea, green tea, soft drinks, chocolate, and energy drinks. Another important rule: never start medications on your own during pregnancy. Even common over-the-counter medicines may not always be safe for a developing baby. Always speak with your doctor before taking anything, including herbal products or supplements. If you have cats at home, there's one precaution worth remembering. Avoid cleaning cat litter if possible. Cat waste can sometimes carry an infection called toxoplasmosis, which may be dangerous during pregnancy. If you absolutely must clean it yourself, wear gloves and wash your hands thoroughly afterward. Now let's move to food and nutrition. You do not need an extreme pregnancy diet. Focus on balanced, nourishing meals with fruits, vegetables, proteins, healthy fats, and enough fluids. If you eat meat, eggs, or seafood, make sure everything is properly cooked. Avoid raw or undercooked animal products because they can increase the risk of infections like salmonella or listeria. And always wash fruits and vegetables carefully before eating. One of the most common first trimester symptoms is nausea, often called morning sickness. But honestly, it doesn't always happen only in the morning. Some women feel nauseous at night, some throughout the entire day, and some never experience it at all. All of these situations can be completely normal. To reduce nausea, eat smaller meals more frequently, avoid very oily or spicy foods, stay hydrated, and avoid keeping your stomach completely empty. Ginger may also help some women feel better. You can try ginger tea, ginger candies, or ginger supplements after discussing with your doctor. However, if vomiting becomes severe and you cannot keep food or water down, that may become a medical condition requiring treatment and IV fluids, so don't ignore extreme dehydration or continuous vomiting. Constipation is another common issue during early pregnancy. Hormonal changes can slow down digestion. To help prevent constipation, drink more water, increase fiber intake, stay physically active, and include fruits and vegetables regularly. Some women notice breast tenderness, bloating, mood swings, acne, or skin darkening during the first trimester. These changes are usually caused by hormonal shifts and often improve gradually. You may also feel unusually tired or sleepy, and honestly, that's completely understandable. Your body is doing an incredible amount of work internally. Rest when needed, sleep properly, stay hydrated, and don't feel guilty about slowing down a little. At the same time, staying active is important too. For most healthy pregnancies, walking, stretching, prenatal yoga, and gentle movement are usually safe during the first trimester. You don't need strict bed rest unless specifically advised by your doctor. Some women may feel mild stretching sensations, lower abdominal discomfort, or back pain as the uterus begins growing. This can be normal, but if you experience severe pain, heavy bleeding, dizziness, or unusual discharge, contact your doctor immediately. And finally, remember this: the first trimester can feel emotionally and physically intense. There may be excitement, fear, nausea, exhaustion, and uncertainty happening all together. But with proper care, regular medical guidance, healthy habits, and patience, most women move through this phase safely and successfully. Take care of yourself, be gentle with your body, and trust the process 1 week at a time. If you found this video helpful, don't forget to like, share, and subscribe to ParentUno for more trusted pregnancy and fertility guidance. We'll see you in the next video.